The opioid epidemic has been making headlines and taking the world by storm. In 2017, it killed more than 150 Nebraskans.
A Lincoln woman's story isn't an easy one for her to tell, but she's hoping it can help those who are struggling with addiction. New at 6, 10 11's Nicole Griffith joins us with more. Nicole?
Tami Johannsen has been suffering from chronic back and body pain. The treatment was a fentanyl patch. After a decade of being on the patch, she decided to make a change.
Approximately.
58-year-old Tami Johannsen doesn't look like your regular drug addict, but she says she is.
I was addicted. I couldn't live without it. You know, my body craved it. I knew every 2 days when I had to put the patch on, I knew when it was coming up.
Johannsen was living in St. Edward, Nebraska, and was taking fentanyl for 10 years. It was a time that became a dark place for the grandmother of 5.
I was in chronic pain. I couldn't walk. Stabbing, just terrible pain.
Johannsen moved to Lincoln seeking help at Bryan Medical Center almost a year ago. She's working with Dr. Kelly Zock and is now taking Suboxone.
There is other options out there, and there are some kind of hopeful things that we can offer.
Johannsen suffers from fibromyalgia, which is a chronic, widespread pain, plus arthritis in her back. However, in under a year of new treatment, she feels like a new person.
I think I'm going on 7 or 8 months, and my life is so much better.
Dr. Zock says there isn't a stereotype for opioid addicts, and anyone who is struggling can learn from Johannsen's journey.
There's patients that walk around all day long that are on opioids who are kind of trapped by the medication, so to speak, and they put on a facade. You're at a point where those medications are causing more harm than good, or they're truly not doing their intended effect.
Tami also utilized Bryan Health's Independence Center for Alcohol and Drug Treatment. She's expected to have back surgery this fall to reduce her back pain even more.